It is essential for normal brain function at small dosages. We have done studies around the world, and there are communities that have low lithium in the water supply, and we know it's associated with major mental illness, depression, aggression, even suicide.
Welcome to the Kids Eating Broccoli podcast, where we believe that raising healthy kids shouldn't be complicated. Our mission is to inspire 20 million families worldwide to take the steps to raise the healthiest generation in our history. We'll interview some of the world's leading experts in nutrition, human potential, and children's health, as well as extraordinary chefs and foodies to gain insight into simple, fun, and creative ways to introduce natural health into homes across this planet. For today's episode of the Kids Eating Broccoli podcast, we have Dr. James Greenblatt, Integrative Psychiatry. Dr. Greenblatt is a pioneer in the field of integrative medicine. He's treated patients with complex behavioral and mood disorders since 1990, and after receiving his medical degree from George Washington University School of Medicine, Dr. Greenblatt completed a psychiatry residency at George Washington University Medical Center. Dr. Greenblatt went on to pursue a 2-year fellowship at Johns Hopkins University School of Medicine to become board certified in child and adolescent psychiatry, where he also serves as the chief resident. During the fellowship, Dr. Greenblatt received specialized training in the diagnosis and treatment of disorders that appear in childhood, such as attention deficit hyperactivity disorder, ADHD, behavioral disorders, autism spectrum disorders, and complex mood and anxiety disorders. Following the fellowship, Dr. Greenblatt noticed the current treatment model in psychiatry relies solely upon symptom-based recommendations for medication, with little consideration for the biomedical individuality or the underlying biological mechanisms that may be contributing or causing symptoms. This prompted Dr. Greenblatt to develop an outpatient clinic, Comprehensive Psychiatric Resources, which provided patient-centered care for families with children struggling with ADHD and other behavioral disorders. Dr. Greenblatt was one of the very few physicians at that time who knew how to utilize nutritional interventions to help patients achieve relief from their symptoms. His work in the 1990s was years ahead of his time, as the field of psychiatry had not yet understood how genetics, nutrition, and biochemistry played a role in an individual's mental well-being. Dr. Greenblatt's expertise in integrative medicine attracted patients from all across the world seeking consultations for complex mood, behavioral, and eating disorders. Pioneers such as Dr. Greenblatt have contributed to the revolution of consumers seeking personalized medicine. The culture has since shifted, and the fields of medicine and psychiatry are rapidly changing. As more physicians are acknowledging the accumulating research looking at nutritional interventions for psychiatric illness. The understanding of genetics, metabolism, and nutrition is now incorporated into mainstream medicine. Integrative medicine has eclipsed terms such as alternative medicine. For the last 3 decades, Dr. Greenblatt has devoted his career to educating his colleagues, clinicians, and patients how integrative medicine can have profound effects on mental wellness and how to employ balanced, integrative strategies in the treatment of mental illness. Dr. Greenblatt has published multiple books, Answers to Anorexia, The Breakthrough Depression Solution, Answers to Binge Eating, Integrative Therapies for Depression, Redefining Models for Assessment, Treatment, and Prevention, Nutritional Lithium, The Cinderella Story, The Breakthrough Depression Solution, sharing his clinical experience treating complex mood and eating disorders utilizing an integrative approach. In his upcoming book, which actually is now released, Finally Focused, The Breakthrough Natural Treatment Plan for ADHD that restores attention, minimizes hyperactivity, and helps eliminate drug side effects. Dr. Greenblatt currently serves as the Chief Medical Officer at Walden Behavioral Care in Waltham, Mass., and serves as an Assistant Clinical Professor of Psychiatry at Tufts University School of Medicine and Dartmouth College School of Medicine. We really appreciate Dr. Greenblatt taking time with us today to share his immense experience and years of wisdom. Some exciting news to share with everyone. I have teamed up with one of the most dynamic people in the ADHD, autism, chronic illness, natural healing world. Her name is Jen Kozak, and she's the author of Healing Without Hurting and the kids' book, A Healthy New Me and ADHD Free. And we've teamed up to create a special group experience for parents of kids who are struggling with any of these conditions, who are looking to help their kids function better and heal naturally, drug-free. The two of us work a lot individually with parents and on social media and online and podcasts and so forth, and we get lots of questions from parents, and often the same questions come up over and over again, which are, there's so much information out there. How do I know what direction to go? You know, I read this book and it told me to eat these things and feed my kid these things. And I read this other book that told me something else. And I read this book that said to get these tests. And I read this book that said those tests are useless and do these things instead. So we decided that what would be a valuable service would be to team up together, bring our own strengths, mine from the natural health, nutrition, neurology world, hers from, she's a practicing psychotherapist, and the mom of 2 kids who she's helped heal from these types of conditions naturally. So we have a lot of awesome background to bring to the table to really support parents like you. And our goal is to be able to lead you through step by step and be able to give you feedback along your journey. So the format is primarily a closed Facebook group, and it has a totally affordable monthly fee because we wanted to make it accessible and affordable for many people to be involved so we could get out there and make a difference, because both of us have the mission of impacting a huge number of parents and kids in this world and make the next generation the best generation. I am going to put the link in the show notes. So if you're not listening on the kidseatingbroccoli.com website or kidseatingbroccoli.podcast.com website, go there, find the show notes for this episode, and you'll find the link to find out more about the group, to sign up. I highly encourage you, and thank you for listening. So in your book, the very first chapter that you have in there is about what you call the miracle mineral, which is magnesium, and which I thought was very interesting that that's what you put right up at the front of the material. So could you tell us a little bit about why that's so important to have it at the very beginning of the material?
Sure. Writing this book, or most books, we spent a lot of time in the order and how to arrange things, and the magnesium chapter coming first wasn't the first thought, but as we put it together, I just realized it was probably one of the most important nutritional deficiencies that we see in kids with ADHD, which is low magnesium. And it's also one of the few things that we could say would be consistent in the vast majority of the kids. You know, in integrative medicine, integrative psychiatry, the way I practice, I stress that every individual is different. We can't just say everyone has to eliminate gluten or dairy, or so we look for those biochemical differences. But I started off with magnesium here because it's the one thing that I think every parent of an ADHD child or an adult with ADHD could take and should take. And so that's why we started off with magnesium.
Gotcha. And what do you think the reason for that is? Why do you see such a pervasive deficiency in magnesium?
Well, I'm pretty convinced there's a genetic component to it because it is so pervasive in ADHD. So there's likely a higher genetic need for it. But also when we're under stress, and our kids with ADHD are kind of always under stress at school and at home, as stress levels go up, we tend to lose magnesium. And obviously, for many of the kids, the food that they're eating are devoid of magnesium. So it's in whole grains and healthier foods. So the combination of it's less in our diet, stress, and I believe a genetic component is probably the reasons it's so common.
Interesting. So yeah, let's jump to a little bit of that. You mentioned, the foods the kids are eating maybe are devoid of those nutrients. Can you talk a little bit about, beyond just magnesium, what are some of the other problems you see in practice and working with parents with their kids who are eating, maybe like a high sugar diet or a processed food diet? How does that work in their bodies and in their brains? And tell us a little bit about what the effects of that are.
Sure. You brought up high sugar, and that's probably the simplest. When I first started 30 years ago, it was clear that sugar exacerbated behavior problems, but there was no research to support it. The one big research article, from the pediatric journal said sugar doesn't affect behavior, and that's what our pediatricians went on. But now we have pretty clear scientific evidence saying that processed food and sugar does affect behavior, exacerbates ADHD. So sugar, refined sugar, large amounts of it, does a couple things in the body. One, it depletes nutrients like B vitamins, which are critical. Also, it's devoid of magnesium, so you have the energy of the calories without the nutrients to process it. And then another mechanisms, particularly when you add the sugar-sweetened beverages, so the sodas and the sweetened juices, is that it adds phosphorus. So phosphoric acid in all these sodas and drinks. So elevated phosphorus is also common, and many people believe contribute to behavior problems in kids.
And so what do you recommend for parents who either are new to this or realize this and want to make a change? What do you recommend as far as making that change to help their kids get off the high sugar?
Well, doing this long enough, I realize that my colleagues, that if we come on too strong or an extreme in telling parents to eliminate all of this or all of that, they might do it for a week, but it just doesn't always work. So my approach is to help educate parents to understand the role of these foods and these high sugar foods. And then as they get a better understanding, they can slowly start making better choices, less sugar in the house, and be respectful of kids with other kids, but slowly introduce nutrient-dense foods, healthier foods. And it's truly amazing over time how the children start asking for both healthier foods and can make better choices themselves.
Yeah, I mean, it seems so unlikely when you're a parent dealing with a picky eater or a child who likes sugar. But, once they start feeling better, I've seen that as well myself, where they start asking for the healthier foods just because they have a sense that, they have had the experience of feeling better. And so sticking on the topic of sort of the eating, you mentioned sugar, which is obviously a huge one. Whenever we see those statistics about how much we eat now versus, 100 years ago, it's shocking. And I know that other dietary aspects can be a big part in our health, in our children's health, and in their, even in their behavioral health and their mental health and so forth. And I know you go into food sensitivities and allergies. Can you talk a little bit about that? Because I think, and let me just sort of direct it specifically, for some people it may be a stretch to consider that a food sensitivity is going to be something that's causing their child to have difficulty paying attention at school or sitting still at school. So can you speak to that for us?
Sure. Again, I try not to have rules for every child with ADHD, because most people will be disappointed. So we don't say eliminate dairy, eliminate wheat, but looking at this allergic reactions to food, and it's not the same allergy that we talk about when we have these peanut allergies where someone develops anaphylactic reaction or hives. These are called delayed hypersensitivities. So it's a different mechanism, the immune system. It's called an IgG allergy. And, when I started 30 years ago, Doris Rapp, a famous allergist, started talking about food allergies affecting behavior. And I've seen it for these 30 years, and mostly in the young kids. So for those that have children 3 to 7 years of age that are having behavior problems, I would say 80-90% of the time there's a food allergy component to it. Signs of food allergies, I think, are important. You sometimes see the red blotchy face, red earlobes, black circles under the eyes, itchy ears, or other signs of allergy, runny nose, things like that. So food allergies can clearly affect behavior. Not every child with ADHD has food allergies, but there's pretty simple tests to determine it.
And what are some of those tests, just so parents can be informed?
Well, I mean, there's a blood test where we can look at 90 different foods. And again, it's not a typical allergy test. It's called an IgG food hypersensitivity test. And many naturopaths, chiropractors, or integrative doctors do that. There's also, in the old days, we used to do something called the pulse test. And after you kind of gave the child the food, if you notice their pulse racing or going up 15 points or 20 points, sometimes even higher, it tends to reflect a allergy to that food. But now it's very simple to get a blood test.
Right. Interesting. So, and then when they have these allergies or these delayed, sensitivities, what is that mechanism, or how does it work that then can affect their ability to sit still in class or their ability to focus on their homework, rather than just sort of like a stomach ache or something more digestive related?
Well, we don't know the exact mechanism, but what typically would happen, and people might have heard the term leaky gut, is that protein, let's just say if it's dairy, that the body has an immune response to the protein, the casein in dairy, and that immune complex of our body seeing the milk or dairy as a foreign entity, that complex crosses the blood-brain barrier and affects behavior.
Gotcha. So the gut health then is affected by these food sensitivities, and then we have the leaky gut, which I know you talk about some in your book as well, the Healing the Gut, Help the Brain section. And that's become, a popular topic in the sort of the natural health world is the intestine and the microbiome. And so is that something we see a lot with these children with the different behavioral issues, or you do in practice?
I think it's a percentage of kids, not every child. So it's hard to say just take probiotics and we can cure ADHD. But there is a subset of kids that we can detect byproducts of bacteria that are creating behavior problems. And these are chemicals that cause agitation. And we actually know the mechanism in the brain. So we can do a urine test to look at these metabolites of bacteria. And then we can give either high-dose probiotics or antibiotics for some to treat what we call the gut, the dysbiosis in the gut. And when we find this, it's really dramatic, and kids can get better within a few months.
Well, that's interesting. So how, you said there's a urine test. Is that something that you can find widely available, or would you have to find just the right practitioner to do that test for you?
Yeah, no, it's not your routine pediatrician wouldn't do it. It's called an organic acid test, and we're looking at a chemical called HPHPA, that's the abbreviation, and it's produced by different strains of bacteria in the gut. But this chemical is so powerful, it really disrupts some of the neurotransmitters in the brain. And we can detect it, so we see it in the urine, and then we treat it, and we can watch it decrease, and we see the behavior is directly correlated.
Wow, that's fascinating. So talk to us a little bit, if you would, also about a supplement, I guess you might call it, that maybe a lot of parents haven't heard of being used for these type of children, and that's the nutritional lithium. Could you tell us a little bit about that?
Sure. I mean, I've been spending much of my time over the past few years talking and writing and researching lithium. So many people think of lithium, they think of a drug, a psychiatric drug for bipolar illness, and it is. But that is at dosages of, let's say, 1,500 milligrams. What people forget is that lithium is an element in the earth. It's a natural element in our soil. And it was actually one of the first few elements formed in the Big Bang 13.8 billion years ago. So we had hydrogen, helium, lithium before Earth was even formed. And lithium is in our soil, and we have lithium salts. So it is essential for normal brain function at small dosages. We have done studies around the world, and there are communities that have low lithium in the water supply, and we know it's associated with major mental illness, depression, aggression, even suicide. And then those communities in the world, and again, tested all over the world, just in the water supply, because lithium leaches from the soil to the water. So in our tap water, higher levels of lithium have protection from mental health problems. So what we've discovered is a subset typically of irritable, aggressive children are low levels of lithium. And by giving just these trace amounts, 1 milligram of lithium, what would be in somebody's water supply, is enough to make a very significant dent in their behavior.
So it's essentially a not well-known nutrient deficiency is what I hear you saying, that we would naturally be getting, but in some cases we're not getting.
Absolutely. Part of it, we can think of what happened in the last 20 years with from tap water to bottled water. So we got $1 billion industry drinking water out of plastic with no natural minerals, certainly no lithium. So that's why I've seen it more. I've been looking at the same test, and it's increased a lot over the past 10 years. And I'm pretty convinced that there are families who have substance abuse histories, families with depression, families with aggressive ADHD that probably have a higher need for lithium. Just like we talk about, biochemical individuality from other nutrients, I believe lithium as an essential nutrient is the same. So between not being in our water supply and some families having a higher genetic need, we're seeing lithium deficient children with behavior problems.
And is this something that can be tested for in a simple blood test?
Yeah, a blood test would not pick it up, but there's a hair test that we do. Lithium, you watch on TV, the crime shows, we can look at minerals and drugs and lithium. So I've been looking at hair levels for 30 years, and we're seeing a lot of undetectable lithium, so there should be lithium in the hair. And there's also now a lab that has come up with a urine test for lithium. So there are two ways we can look at lithium levels in the body.
So just stepping away from simply, kids' health and ADHD, just for a second, are you saying that over the years, the 20 or 30 years you've been studying this, that across the board you've been seeing decreased levels of lithium in the population?
Absolutely, yes.
And then could we make the rational jump to maybe that's why we're seeing more, crimes of anger and aggression and people with mental health issues that, that they get medicated for?
Well, that's my career. Yes, yeah. I certainly believe that. And, I think the public health implications are profound. We're talking about a nutrient you can buy on Amazon. And for the kids, sometimes we just use, little drops of getting microdoses of lithium has profound implications for behavior, particularly irritability and aggression.
Yeah, that's fascinating, especially because, I'm sure you run into it all the time. I mean, but that when you mention the word lithium, like you said at the beginning of this, question about it, that most people think of a heavy-duty psychiatric drug and not an essential nutrient that they're not getting if they're drinking bottled water and so forth. I could see how that would be profound. So that's definitely something to be aware of. Anyone listening with your family, certainly if you drink bottled water or, maybe any water supply where the nutrients are taken out. And then especially if you or, your kids or anyone in your family is suffering from any of those type of things that it was mentioned, would you suggest people test for it, or would you suggest they just get a supplement and try it, or what? How do you suggest going forward?
Yeah, I don't think people should just take a supplement, but pregnant women shouldn't take it if you have thyroid disease. But I do think if someone is struggling with any major psychiatric illness, ADHD in children, depression, anger issues, then absolutely looking at a hair test or the urine test to detect lithium, and go to a practitioner that's comfortable with it, then absolutely it can be easily supplemented with.
Okay, well, that's great. Great piece of information there. And then before we wrap up, I wanted to just ask you, in reference to some of the material in your book here, a lot of it is related to nutrients, nutrition, food, and so forth. But some of the later chapters are on some other areas like deep sleep and regular exercise, and then also mindfulness. So could you tell us a little bit about why it was important to include that stuff in your book as well?
Sure. I mean, as an integrative psychiatrist, I use the term, nourishing the brain, which is all my nutrition, biochemistry, and then, nurturing the mind, the other part of who we are and the way we can affect brain function. So in the book, again, I've been treating ADHD for many years, but the research is now available to make the things that were common sense to many of us now science and evidence-based. So the research is really clear that exercise helps attention. The research is clear now that being in nature, vitamin N, being in nature can improve attention in children. And the one that might be surprising is mindfulness. We think of mindfulness for anxiety, but not for a hyperactive ADHD kid. But there's good research looking at mindfulness programs, and they're set up around the country to help children with ADHD. So it's really important that parents understand that there are both biochemical approaches with nutritional supplement, and then there are lifestyle changes that can affect behavior and attention problems.
And what I think is great about those as well, I mean, in addition to treating the whole person, there's also, spending time in nature, getting regular exercise, practicing mindfulness. The side effects are only better health. Even if it doesn't solve the ADHD or completely resolve the symptoms, that those are all things that are going to be beneficial to the person who's doing those. So I think that's a great add there. Well, why don't you tell our listeners, if they want to know more about you, want to find you and what you're up to these days, and even maybe if they wanted to try to reach out and contact you, what would be the best ways to find you online?
Sure. I think our website, which is my name, jamesgreenblattmd.com, probably will have most of the information. We have a series of books called Psychiatry Redefined, that we're publishing, going through every major mental illness, depression, anxiety, including ADHD, helping parents look at some of the alternatives, as well as courses for professionals. So we're working, trying to train professionals, as well as help parents and patients sift through all the information overload that we're getting on the internet.
Yeah, that's wonderful. That's really the new world we're in, where finding the information is no longer an issue. It's what do you do with the overwhelming quantity of information. So that's wonderful that that's part of your focus. Well, I thank you so much for jumping on with us for this interview today and sharing some of your vast information and wisdom. I really appreciate it. I'm sure that many of the listeners will be looking up your website to learn more and find out more about you and the work you do, so they can help their kids and their families thrive. So I just want to say I really appreciate it, and thank you so much for being part of the Kids Eating Broccoli podcast.
No problem. Thanks for having me. I appreciate the work you're doing. Take care.
All right. Bye-bye now. If you enjoyed this episode of Kids Eating Broccoli podcast, connect with us online. You can find us on Facebook at Kids Eating Broccoli Podcast or at Dr. Brad Ellisor DC. You can also go to our website, drellisor.com. That's DOCTORELLISOR.com. Go to iTunes and leave us a review and a rating, or on Stitcher. And be sure to keep in touch with us so you can hear the next episode. Sign up for our mailing list or like us on Facebook. You guys take care now, and let's make the next generation the best generation.